Welcome back, dear viewers. In this video, I would like to continue the hepatitis B viruses replication pattern, different phases of pathogenesis, clinical syndrome caused by the hepatitis B virus, its lab diagnosis and treatment methods. In the previous video, I have discussed about the hepatitis B viruses, general characteristics, structure and mode of transmission. I am Dr.M.Manigandan, Assistant Professor, Department of Microbiology, Sacred Heart College. Replication of the hepatitis B viruses. All the hepatitis viruses have defined tissue tropism, especially for the liver tissues of host, and the viral replication starts within 3 days of entry into host. The hepatitis B viruses replicates through an RNA intermediate with the help of a reverse transcriptase enzyme, and it produces and releases antigenic decoy particles, that is hepatitis B surface antigens. This antigen also serves as a viral attachment protein, and the genome on penetration into the host cell, which is partially incomplete, becomes completed to form a double-stranded DNA circle and then delivered to the host cell's nucleus, where it produces numerous mRNAs, among which a larger mRNA of a 3500 base is used to encode the hepatitis B core antigen and hepatitis B envelope antigen with the polymerase enzyme and a protein primer for the viral DNA replication. Viral transcription occurs in the nucleus and the translation occurs in the cytoplasm of host cell. The virion after production is released from the hepatocytes by exocytosis process without killing the host cell. The larger mRNA of 3500 base acts as a template which produces a negative stranded DNA, and after which a positive opposite copy is synthesized using a protein primer, and this polymerase enzyme has a reverse transcriptase activity along with the ribonuclease H. It does not as the integrate activity similar like a retrovirus. The entire genome of the virus can also be integrated into the host cell chromatin. This kind of integration of viral DNA has been found in the hepatocellular carcinoma. Pathogenesis of hepatitis B viruses. Hepatitis B virus can cause acute or chronic, symptomatic or asymptomatic disease. The major sources of infectious virus is blood, but HPV can be found in semen, saliva, milk, vaginal and menstrual secretions, and also in amniotic fluid. The virus starts to replicate within 3 days of infection, but as already noted, symptoms may not be observed for 45 days or even longer. This depends on the infectious dose, the route of infection, and the person's immunity. The virus replicates in the liver cells, that is hepatocytes, with a minimal cytopathic effect. Infection proceeds for a relatively longer time without causing liver damage, that is elevation of liver enzyme or its symptoms. During this time, the copies of HPV genome integrate into the hepatocyte chromatin, that is liver cell chromatin, and it remains for latent for a longer period. An insufficient T cell response to the infection generally results in the occurrence of mild symptoms and inability to resolve the infection and the development of chronic hepatitis. Chronic infection also exhausts CD8 T cells, preventing them from killing the infected cells. Antibody can protect against initial infection by preventing delivery of the virus to the liver. The different phases of pathogenesis. During the incubation period, the patient may experience fever, rash, and arthritis. The HPV infection is characterized by a long incubation period and an insidious onset. Symptoms during the prodromal period may include fever, malaise, and anorexia. This is followed by nausea, vomiting, abdominal discomfort, and chills. The classic icteric symptoms of liver damage, that is jaundice, dark urine, pale stools, follows soon thereafter. The recovery from the HPV infection is indicated by a decline in the fever and a renewed appetite. This is in the case of an acute infection. The second most common cause of hepatitis is the fulminant hepatitis. The fulminant hepatitis occurs in approximately 1% of ecteric patients and it may be fatal. The fulminant hepatitis is marked by more severe symptoms and indications of severe liver damage such as ascites and bleeding. Hepatitis B virus infections can promote hypersensitivity reactions in the infected person that are caused by immune complexes mediated by hepatitis B surface antigen and antibody complex. These may produce rashes, polyarthritis, fever, acute necrotizing vasculitis, and glomerulonephritis in the infected person. The third one is the chronic infection. The chronic hepatitis occurs in 5 to 10% of the people with the HBV infections. This happens usually after mild or inapparent initial diseases. Approximately one third of these people have chronic active hepatitis with the continued destruction of the liver leading to scarring of the liver, cirrhosis, liver failure, or primary hepatocellular carcinoma. The chronic hepatitis may be detected by accidentally by finding elevated liver enzymes on a routine blood chemistry profile. Chronically infected people are the major source for spread of the virus and are risk for fulminant diseases if they become co-infected with the hepatitis D viruses. The fourth clinical syndrome is the primary hepatocellular carcinoma. The World Health Organization estimates that 80% of all cases of primary hepatocellular carcinoma can be attributed to chronic hepatitis B virus infections. The HPV genome is integrated into these PHC cells and the cells express HPV antigens. PHC is usually fatal and is one of the third most common causes of cancer mortality in the world. Lab diagnosis. The initial diagnosis of hepatitis can be made on the basis of clinical symptoms and the presence of liver enzymes in the blood. Acute and chronic HPV can be identified and distinguished by the presence of surface antigen and the envelope antigen in the serum. The detection of envelope antigen is the best correlate to the presence of infectious virus particle in the blood. The amount of virus in the blood can be determined by the quantitative genome assays using polymerase chain reaction and related techniques. Regarding the treatment, hepatitis B immunoglobulin may be administered within a week of exposure and to the newborn infants of hepatitis B surface antigen positive mothers to prevent and cure the disease. Chronic hepatitis B virus infections can be treated with drugs targeted at the polymerase enzymes, for example, lamivudine, which is also act as an HIV reverse transcriptase inhibitor. Vaccination is recommended for infant children and especially people in high risk group. This is all about the hepatitis B viruses infection, replication, pathogenesis, clinical syndrome, and lab diagnosis and treatment. Thank you for your patient listening. Kindly subscribe and share our videos to encourage us. Thank you.